So as part of the CHAMP study, we integrated what we call the Cincinnati Children's Hospital approach. Whenever you design a study, you do have to make sure that you control for as many factors as possible and looking for really your dependent variable that you're varying, which was the purpose of the CHAMP study was the medication. So at Cincinnati Children's Hospital Headache Center, we're now celebrating our 20th year of taking care of children and adolescents. We use a very semi-structured approach. We call it a semi-structured interview, where we maintain consistency in terms of the evaluation, the diagnosis, and the management. So the evaluation is through the semi-structured interview with a full neurological, pediatric, and headache examination. Based on the results of that semi-structured interview, we use the International Classification of Headache Disorders to determine the diagnosis for these children and adolescents. Once that diagnosis is assured and there's no warning factors that further evaluation is needed, we come up with a treatment plan that includes acute therapy, so what the child needs to do during the acute onset of their headaches, the preventative therapy, which can include a combination of pharmacological as well as other interventions, including psychological interventions, cognitive behavioral therapy, and what we call biobehavioral therapy, which is really discussing how it's important to take good care of yourself, making sure that you get adequate fluid hydration, exercise on a regular basis, not just for your body health, but for brain health, maintain a healthy eating pattern, not skipping meals, which is difficult for a lot of kids, where in most of the country kids are sleep deprived because schools force them to get up too early in the morning, as well as maintaining an adequate balanced diet, including vegetables, meat, and dairy that have the vitamins that we've been able to identify are deficient in many of the kids we see with frequent headaches. And then the final and equally important healthy habit is maintaining enough sleep on a regular basis. Most of the kids in the world are sleep deprived, in the United States especially so, as we sort of make their busy lives fit together. And an integral part of this is cognitive behavioral therapy. So nearly all the children that we see that average more than one headache a week, we introduce the idea of adding cognitive behavioral therapy. In studies we have done, we've shown that cognitive behavioral therapy is equal or more effective than many of the medications that are used in adults and pediatrics for the prevention of headaches. So it does need to be a really integrated part of that treatment. We've treated over 13,000 kids this way. We've successfully been able to really control and change the outcome. And some of the longer term studies we're looking at saying this is maintained for 3, 5, 10, 15 years afterwards. So one of our goals is to really stop this from being a lifelong disabling problem, even though we realize that kids and young adults and into adulthood may continue to have intermittent headaches, but we really want to teach them how to control their own disorder and not have to rely on medications or lifelong medical management.